This podcast represents the opinions of Katie Allen, PA, and guests of her show. The content is for informational purposes only and in no way sets up a patient relationship. Consult your healthcare professional for any medical questions. Now, here's Katie Allen.
I see you. Oh my God, that sounds a little bit creepy. But the point is to start talking about the eyes. This podcast is Make Me Pretty, Tomboy Turn Plastic Surgery PA. And I'm Katie Allen, a PA, just so you know, that's the one we're talking about. And I've been a physician assistant in plastic surgery for over 15 years. It is said that the eyes are the window to the soul. We're not usually talking about those eyes. We're talking about aging and how that's showing up around the eye area. We're usually actually talking about the tissues that surround the eyes and how they're affected with aging. In fact, the eyes is usually the first thing that we see change with aging. And sometimes we're not even really talking about aging. We're talking about the structures that you've been born with and maybe you're not so happy with that we're trying to correct. On today's episode, we're going to talk about the aging eye and again, focus on the tissues primarily surrounding the eye. Why does it do this? Why does it start to change? Why on some people does it look different than others? And of course, what can we do about it? How can we allow the eyes to look like they're aging beautifully and naturally on the cheap? You can't. Okay. So for the best results, you might need to invest a little bit of finances and a little bit of downtime. But in my opinion, it's totally worth it. It can affect not just your own personal well-being and your evaluation of yourself, but this is an area that definitely could affect your career. Quite honestly, if you look tired all the time, people might not start to trust you quite the same or your advice. If you look sad, they might think that you're weak. If you look puffy, well, not going to go into that. Many of us have at least one area around our eyes that bothers us the most, that we'd like to do something about, whether it's dark circles, bags, crepiness, wrinkling, tear troughs, laxity to the tissues, hollowness, puffiness, and it just keeps going. And that's just addressing the lower lids. And that's what we're going to focus on today, just the lower lid tissue. We'll talk about the upper lids in a future episode. So what are some of the things that start to happen with aging around the eye? What are some of the things that happen to the tissue? I know each individual is completely different, right? So some people get one thing, some people get something else, some people get the whole kitchen sink thrown at them. And let's be honest, we all know they look tired, angry, sad, everything that you can imagine. Probably one of the most common things that I hear people complain about when they talk about the area around their eyes is primarily that people are stating that they look tired. More than, again, anything else, it's more that they either feel like they look tired or that other folks are starting to say, hey, you look tired. Are you okay? Things such as this. And maybe you are tired. But in all reality, this affects the way that we view ourselves when we're looking at ourselves in the mirror. If we look tired, we may start to feel tired. Or maybe it's the one we already feel a little bit tired. You look at yourself in the mirror and you go, God, I already felt tired, but God, I look really tired. I must be beat up. Or what if we were able to do something about that? And so instead, you might even feel a little tired, but you go to the mirror and you go, yeah, I felt a little tired, but now I'm starting to feel a little bit better. I'm not so bad. Look at this. Sounds kind of funny, but our appearance affects a lot about how we view ourselves and how others view us, which may affect our business, may affect our social lives, which in turn affect how, again, we feel about ourselves. So it's kind of a big domino effect, actually. And you can see that if the eyes are the thing that tend to start to show aging first, maybe that's the thing that we need to at least think about addressing first, or at least addressing kind of towards the beginning. Let's at least evaluate strongly this area. So what are some of the things that change with aging to the tissues that surround the eye? Let's start with volume loss. That includes lots of volume to the bone, as well as the soft tissue surrounding the eye, which starts to lead to shadows and a hollowing appearance. As we age, the very normal fat pad that lies underneath the eye begins to herniate forward and downward, which kind of gives a saddened appearance in itself if you kind of think about like a basset hound, to be quite honest. Shout out, Bo. Now, with some, it's worse than others. And even on some individuals, it shows up at earlier ages, which tells you there's a genetic component to this and how the tissues respond to aging. But there are also lifestyle choices I'd say the top contributing environmental factors may include significant damage from the sun, things like smoking, as well as hydration and diet. But genetics still have probably one of the highest contributing factors. The area with the most significant amount of loss of volume is really a convexity, and that is often referred to as the tear trough. Now, when it comes to loss of volume in this area, I like to point out that most folks who have a loss of volume that is substantial in this region also have a loss of volume just inferior to that in a portion of the cheek. Why I think that's important is kind of something that I'll address a little bit later when it comes to things that we can do to benefit this region. But if we're not looking at the cheek region in addition to the tear trough, it'll be difficult to correct that area. And we'll speak about that in just a moment. Another contributing factor to aging is the loss of collagen. Surprise! Not. We see that loss of collagen throughout the entire face. So when we're really talking about the lower lid, we're talking about a loss of collagen, which can lead to a more of a translucent appearance, which makes the skin that was already thin appear a little bit thinner, which means we might be able to see more of the blood vessels and things underneath, which we often don't like the appearance of. And that thinness and loss of collagen and eventually some elastin too, leads to that crepiness and wrinkling. The translucency of the skin with the thinning may lead to us seeing those darker blood vessels even more, which oftentimes contributes to us looking even more tired. This is one contributing factor to dark circles. Now, other things such as allergies may contribute to the appearance of darker circles, none of which look any good. So let's go back to collagen. Basically, at the time that we are born and as we begin to age over time, we see a breakdown of collagen. But as we're younger, we're producing more collagen than we're breaking down. And what we start to see is that starts to kind of flip-flop just gradually, where we start to get more collagen breakdown than we're able to build up without a little help. So we have to do something to make this even out. There is bony loss with aging, and this does contribute to the original thing discussed, which was the volume loss. But there is always so much control that we have over this. Some of this is, in fact, genetic, and we see this different in different races as well because of genetic factors. But overall, bone loss is a bit out of our control. We will see dynamic lines, such as with the crow's feet, that is in the lateral area of the eye, that do have a contributing factor on some individuals as far as looking like they are fatigued or tired. And in some ways, that portion of the eye muscle, that periorbicular muscle, can pull down on the eye just a bit, contributing to a bit of a harsher or more tired appearance. The brightness of the skin is also a contributing factor to the appearance of being aged or tired in appearance, because brightness is in fact the opposite of shadowing, which is where we think of that darkness as pulling away or looking more grim, tired, or sad. All right, so we covered the doom and gloom of the aging eye. So now what are we going to do about it? What can we do about it? What are our options? I'm going to go back to the thing that you will probably hear me say the most in almost every single episode when it comes to something that we can do. If you find a provider that you trust, you will know what's best for you on the best timing. Because if they don't know what to do, they will find somebody who does, or somebody who at least knows more than they do. Let's speak about the shadows and the hollowing to the area, which actually also includes puffiness, because that puffiness, which is elevated off of the primary level of the skin, also creates a shadowing. So there is a bony rim that surrounds the eye, and hollowing often extends around that area, in some areas more than others. When it extends more medially downward, we're talking about really the tear trough region, which is primarily characterized by a loss of volume to that region. And that can be corrected by adding volume to that area, which is most commonly done at this day and time with filler. However, when I'm looking at that region, before I have somebody think about investing their money into something such as filler, I'm going to look more lateral to that and see kind of what the more bag area we think of puffiness under the eye. What does that look like? If there is a significant amount of puffiness in this zone, then for me, most people need to have this addressed with a surgery. And why I say that is if I go and are able to fill this lower tear trough area with a certain kind of filler or fillers, and the lateral portion to that, which is more puffy, has not been addressed, then it's only going to look so good, but you're still going to look puffy. And that's a lot of money to spend on something to look ish. So we want you to look your best. So if I see this area being puffy, I'm most likely going to talk to somebody about doing something called a blepharoplasty, which is where I would request that my plastic surgeon see our patient, and they would discuss in a consult whether or not to remove that excess fatty tissue, which is not there on every single person. But when it is substantial in appearance, then that can be removed. A blepharoplasty is just basically something that we can discuss in future episodes. So it's basically a very simple surgical procedure that can be done under local. And when I say simple, it's because I'm the assistant. But what I should say is to the patient, it's fairly simple. We often do this with the patient just taking something like an oral medication. That does mean they need a driver, but then they're able to come. They're usually at our office for a total of maybe 2 hours or so. They do have to refrain from major physical activity, such as exercise, usually significantly for at least the first 2 weeks, but really up to 4 weeks, just to support the healing process. When we're looking at aging tissues and they're doing this blepharoplasty, sometimes the surgeon needs to evaluate whether or not somebody needs a canthopexy. Now, I am a fan of the canthopexy, but again, I'm the assistant. I'm not doing the work. And I'll work for a man that never makes it sound like it is much different to do the blepharoplasty versus the canthopexy as far as the technique from his standpoint as the surgeon. There is a definite difference in outcome, especially when you have a great surgeon that's doing this. To me, the biggest difference is that the canthopexy allows the surgeon to remove more skin. And when there's some crepiness of the skin, we have some things that are good for that I'll talk about in a moment that we can do. But we really need to first have some surgical removal of tissue on some patients where it's more significant. And that is something that's difficult to tell you on a podcast or on a YouTube or anything else. That's a little bit based on experience. A canthopexy is just usually several $100s difference. And, I find that typically when folks are over usually the age of 50, I'm finding that most people I'd rather us do a canthopexy on. Now, again, I can say this because I work with a surgeon such as I do. When I think of folks being concerned that the eye shape would change with a surgical procedure, I think that's probably the canthopexy, although I work for Dr. Glenn Walton and I have yet to see one person's eye shape change, nor one person complain about the eye shape changing. So yes, I'm really just seeing that in a lot of patients, this is the better option because you're able to be a little bit more aggressive in some areas. We can put people to sleep for this procedure, but again, so many people tolerate doing it under local anesthesia, and then we give you some medicines ahead of time, which make you kind of not care quite so much. And folks do quite well. We'll talk about this in more detail in future episodes. So when I'm evaluating somebody, I first decide, do they need something in advance of me getting a hold of them? Because again, my whole goal is that you be happy. And when I say happy, I want you to go to the mirror and go, yeah, I like it. I'm okay with this, and this aging, but I'm feeling a whole lot better about what I chose to do. What are we going to do when it comes to the aging of the eye? And we're talking about the loss of collagen because again, we're getting more collagen lost than we're getting collagen built over time without doing something. So what are we going to do? What are some options that we can do to increase collagen? Tretinoin. So the most common brand name being Retin-A, but again, we're going to talk about tretinoin. Now, don't go home and go rubbing your tretinoin all around your eyelid. If you haven't been using tretinoin for what I say is usually about at least a year, then that doesn't usually need to go directly on the eyelid. Bad things will happen. You're going to end up swelling shut. So tretinoin is something that you have to ease into the area around the eyelid. I often tell folks that I believe that if you put the tretinoin everywhere else on the face, it will kind of creep into that area over time. And once you've been using it around a year or so, you can start to dabble around the area with a little bit of that tretinoin and starting to use it maybe once, maybe twice a week, but starting with the once a week, see how your eyelids do. Do they get red, irritated, things like that? If they don't, maybe you can go to twice a week. But even in the most experienced person with tretinoin, usually it's not much more than that, or it'll just look dry and crepey, things like that. But tretinoin is one of the best bangs for the one of the most bangs for the buck as far as increasing collagen production. There are also some modalities such as lasers, which I'm not really going to get into as much in this episode of Make Me Pretty podcast, but in future episodes we can talk about that more. There are also things like radio frequencies, such as we have the N-Modes Morpheus 8. There is some kind of minimal science that start to talk about microneedling, but I don't really think that by itself it's the best bang for the buck. I think if you're microneedling and using that to drive in things like PRP, where your own blood is drawn up, and a portion of that serum is utilized in that pen, microneedling is driving that product down into the tissues. Or if you were able to microneedle really more like a dozen times, and that would be spread out like a month apart. But really, when it comes to microneedling, I think you got to stick with it. I don't think it's several treatments worth or, like 3 treatments worth. I just don't think that gets you very far for you to be satisfied for the amount of money that you're spending. That's just my personal take on it. I'm not necessarily right. I'm just one person, but I really think you got to think of it kind of as a long-term commitment when it comes to microneedling. The positive to microneedling is you can do something like that. It gets a little bit red, but you can really kind of get back to work over the next couple of days. And if you're driving in products, that's a great way to drive products in. But the way that I see it is a little bit more like, you can just spend another couple $100, and maybe we're looking at doing something like microneedling that also has the radio frequency or something like that. Again, even there, that is just one tool to the many tools that you need for getting the best results around the eye to being the most refreshed looking. Fraxel is probably one of my favorite lasers for around the eye, and still even that, it still has some risks that are involved. Ablative lasers, I really try to talk you out of them because I just think the overall recovery time is so long for what you get out of it. But I am just one person with that experience, and with some other folks with a little bit more support with staff and things like that, maybe they would choose that. The actual skin brightness, that can be improved with a variety of things, even including things like the replacement of volume, such as with the fillers, that can improve the skin brightness, but some of it is in with skincare. Now, when it comes to skincare around the eyes, we are not all going to agree here, and that is okay. That tissue is so different on so many different people, and what we each have available to us in our individual offices also contributes to our feelings on this. When it comes to skincare around the eyes, I wish we could talk about this some more. I do not personally, or I have not personally found a magical eye cream. And if you have, please let me know. And when I say that, there are a multitude of things that are occurring around the eyes for a lot of folks that they're looking for this magical serum. If you have puffiness, the eye cream that addresses puffiness is not necessarily going to be the eye cream that addresses more wrinkling. I haven't found one eye cream that addresses everything. It's also one more thing on the big list of products that you had to buy for your entire face in order to try to keep your youthfulness up. To me, a lot of eye creams just don't address enough. So whether or not I'm right or wrong, and each individual is different, and if you have extremely sensitive eyes or have never used skincare products, the eyes are not the place to start. So don't say that I said to start here. But if you've been using an extensive skincare program on your entire face for a year, and I think a year is really important on the time stretch here, because those tissues get used to it. You're in a habit of utilizing these things. But to me, most of the time around the eye, I believe that you should have a good skincare regimen for the rest of their face. And most of those skincare products can be actually used around the eye once you are used to it. That includes a tretinoin. But you cannot start with a tretinoin around your eyelids. So if you do, you will come up puffy. You won't be able to see me because you'll be so swollen shut. But after you've been using something, again, around a year, you can try that on that region. That will help turn over the skin cells, which will help brighten the tissue over time. Now, you might look a little extra dry to that area to start with this because it has a little bit of time to get used to it, but in time, this would help. Also, things like your vitamin C's, again, don't start there, but over time, you can try to utilize your vitamin C a couple of times a week directly around the eye. And many of your other peptic acids as well. Hyaluronic acid, topically, might be useful around this area, and ceramimides, and overall light moisturizers, which can help to hold in the moisture to the skin cells as you sleep. I find that heavier creams don't work well during the day because they get in the way really of most of your makeup products or overall just look or feel heavy. I scream, you scream, we all scream for eye cream. So to me, there isn't any magical eye cream that is really out there, or we'd be selling it and it'd be $800 to $1,000. In general, you need to ask your provider, your esthetician, your nurse, your PA, your MP, your doctor, what they think is best for you. And I would go with that. Sometimes there's actually some darkening of the skin, and we can utilize skincare in order to lighten that tissue, such as things that contain kojic acid or hyaluronic acid or contain niacinamide. If we are looking at the visualization of the blood vessels to this area, we can sometimes look just slightly at things like vitamin K to focally lessen blood flow to this area. There are certain lasers that can be utilized for this as well, but that outcome can be a bit difficult to predict in some individuals. And oftentimes patient selection is what's important. You guys, you ladies, you men, alcohol makes this look worse. So if you went out with a night with your girlfriends the night before, and then you're coming in to see me and you're asking me to evaluate the eyes, I'm going to tell you straight up, hey, do your eyes always look like this? And my patients know. I can tell the difference between when you look like you are aging at the typical rate I expect you to versus you come in and I go, oh shit. And usually you're laughing too. Now, as I say that to you, my next question is usually, are you having fun last night? Or, or is something substantial going on in your life? And I'm more like a boy. I don't really want to know the details, okay? I don't want to know about your stuff. But what I really want to know is, has something significantly changed? Which means I don't want you investing a lot in this newfound thing. And we're usually going to kind of know together, at least most of my patients, again, that I've gotten to know over time. I just have an instinct that says something's changed. Something's changed faster than I expect. So what can we do to fill the hollowness to the area that we really consider the tear trough area? Well, I use filler predominantly. In general, the Plastic Surgery Association believes that fat to this area may not be the best choice just because it can appear lumpy. If somebody has had a substantial amount of time utilizing fat and they're very comfortable, then so be it. I'm sure there are those that are that way, but it's just difficult to reverse. So as of right now, the thing that I know to be the best contributory factor to this area would be filler. Picking the filler that somebody is most comfortable with, that is not very hydrophilic, is significantly important. In the tear trough area, I use a cannula most predominantly. Sometimes when you get a little bit more lateral, I might be utilizing a needle to this area. In addition, I usually use a little bit of a combo. But when I'm really getting close medially, I'm utilizing a cannula in this area. And again, specifically choosing the fillers that I feel like are most important. I do think that if you're going to correct the tear trough, that for most people, they're going to need to be corrected in the cheek region as well. So it is quite common that if you come in for a consult with me and you're looking to inject or fill the tear trough region, and I think that you're a good candidate, then I'm most likely going to be talking to you about correcting the cheek area, unless we've already corrected the cheek in the past. And it's because I want somebody to have the most optimal result, and I think that oftentimes those two correlate really, again, when you're losing volume on one part of the face, you're usually losing volume on multiple parts of the face. So I think that it's important to correct both of those to give you the best result. I also think that less is best when it comes to the tear troughs. I have to remind myself of this. I've gotten taught this lesson by myself multitude of times, but less is better. I oftentimes will tell my patients, look, my goal is to correct this about 80%. That means when you leave out of here, I'd like to put a little bit more to bring you up to 100%, but I have to tell myself, no, you need to hold back. What we're trying to anticipate is the fact that you might go eat a Mexican meal, you might have pizza, you might have a night out with friends, or you might have cried at a sad movie. And I need to try to make sure that you look like the typical amount of puffiness, but that it doesn't exceed that. Things around the eye are complex. We have abundance of lymphatic circulation that when changed can have an effect. We have all kinds of anatomical structures and their functions that contribute to this as well. And then there are a lot of outside factors. So again, utilizing or picking the best filler for this area is really important and not overdoing it. If somebody has a substantial tear trough, it is common for me to also tell them, let's do this amount, and then I'm going to have you come back and follow up with me in 4 to 8 weeks, and let's see if you need a little bit more, as these products often expand a little bit under the tissue over the weeks following the injection. So what do I think the biggest deal is around the eyes? Kind of the same as everything else. Make Me Pretty podcast is going to say, you guys, wear your sunscreen. So when it comes to the eyelid area, mineral sunscreen is probably the thing that I would really state to be the thing that you're looking for. So chemical sunscreens around the eye can cause burning, and so a lot of times people will kind of avoid this. I really like Elta MD for a lot of their sunscreens. There are a lot of other sunscreens that are out there that I will kind of tell you about in the future, but Elta MD has one that I really like. It's a mineral sunscreen for around the eyelid area, and I think that is probably your biggest preventative measure when it comes to aging around the eye. Good sunglasses that cover this region are also significantly important. I have blue eyes. My eyes are already a little bit sensitive, but I am shocked at the amount of time that I think back to as a child and teenager that I was not wearing sunglasses. I'm not really sure how I did that. As I age, the eyes become more sensitive, so it's easier to just slam those sunglasses on, and that adds to protection. But I really think that we need to start trying to educate our younger folks about the need for sunglasses at a younger age, because again, that also contributes to protecting the skin from the damaging breakdown of the sun. One more time, I'm going to put in there, smoking is going to make you look like crap. So I often say, for the boys, I'll say things aren't going to work later in life. And for the girls, I'll say, you're going to look like you're aged and you look like crap. Now, it's both for the same, but I just like to kind of get us motivated. If you are smoking, it's going to make your tissues start to look broken down, because just like the sun, it is breaking down through free radicals, the tissues, a large portion of the tissues, and that just does not look good or healthy. And now we've got to play reverse. And if you're continuing to smoke, well, I'm probably not the person to see, or at least don't let me know. It just has such a negative effect on the skin. There are definitely some makeup techniques that can help with this area, but I found that by the time somebody's entering my office to say that they are dissatisfied with the appearance of the tissues under the eyes, or that they're wanting prevention, there's really usually something else more substantial that needs to be taking place besides makeup type tricks. So oftentimes we're doing something that then allows you to do the makeup tricks to make that better. But oftentimes by the time you're seeing me, we need something bigger going on than a makeup trick. But I don't think it's bad to kind of learn some of those. You guys that know me know that makeup tricks are not my thing. And maybe they will be one day, but I don't really know what they are to tell you, other than people tell me them, but I don't practice them. So I try not to act like an expert there, but there are always some additional things that you can learn. I have found that most people that I see with concealer under the eye, quite frankly, it might look good for a moment, but oftentimes it settles down into the creases and makes people, in fact, look more tired. I am sure there is a handfuls of things that are out there that are okay, but I just find that once again, you're entering my office, there is something more significant going on, and you have failed at everything else that you've tried to do on your own. As we are entering 2021, we are all still wearing masks. And this, in fact, is just highlighting the eyes even more than it already was. And so I think that it is adding to the popularity of addressing the eye, although I feel like that was already a pretty popular subject in the past, because again, it's the area that people tend to look at the most with you, or look at first on you. It's also the area that shows the signs of aging the most. And for some, I have folks that are in their 20s that were doing things around the eyes. If we're looking at the lateral portion of the eye, we might be really looking at some Botox. If we're looking at more of the medial portion of the eye, maybe we're looking at things like filler to that region. If we're looking to the lower eyelid, we might be looking at a surgical thing such as blepharoplasty, canthopexy. We might be looking at lasers to this area. All in all, my final comment in virtually every topic that we cover is You've got to find a provider in your area that you trust to tell you the absolute truth of what they know. And it's okay to tell you that they are good at what they know to do, or that maybe they are not, and to refer you somewhere else. But you are looking for the provider that you trust. I often say that my goal is to look like I do lots of yoga and drink lots of water. And in that, we would see a lot of youth and health and bright light reflections to the eye if we were to have this overall appearance. I say fake it till you make it. So maybe you need to see a local provider to see the best ways to address the eyes to help you also look the most hydrated and refreshed that you can. Never hurts to work on your actual hydration. Thank you so much for joining me today on Make Me Pretty podcast, Tomboy Turn Plastic Surgery PA. Please follow me on Instagram at Make Me Pretty Podcast, or Facebook at Make Me Pretty Podcast, or www.makemepretty.org. If you'd like to see me in my office for injections, procedures, or my personal opinion, you can contact my office for a consult at 770-534-1856. It is Northeast Georgia Plastic Surgery, and I'm Katie Allen, physician assistant and your host of Make Me Pretty podcast. Until next time, we will address the upper eyelid and the upper brow and that tissue that surrounds the upper eye. Till next time.